Hi, my name is Dawn Abbott. This is a presentation for functional training and assessment. We're going to talk about myofascial lines. So myofascial lines are essentially lines of muscle and connective tissue that move across the body. There's various ones. And essentially the theory is that not just one muscle, say in the arm, is going to allow for arm movement. You're going to have a series of muscles that are connected. They're going to help with posture and with movement through the body. And we're going to touch on a few of them here. So the first one we're going to talk about is the superficial back line, which runs along the back of the body, and I will show a picture here. It works in the sagittal plane, and essentially it works to hold the body in upright extension. And these muscles actually run all the way from the toes right up to the skull, right up to the top of the head. And it's going to help, like I say, hold the body posturally upwards. The next line is the superficial front line, which acts to contract the front of the body and acts to kind of balance out that superficial back line. We're also working in the sagittal plane for this line, and we're also moving from the toes all the way to the head. And there's a picture of those muscles there. And like I say, it's a series of a number of muscles held together with connective tissue that's helping us along that line. The next line that we talk about is the lateral line, which are a series of muscles along the lateral aspect of the body. It's going to help with lateral bending of the trunk, abduction of the hip, and eversion of the foot. And for this one, we're actually working in the frontal plane rather than the sagittal plane. And again, we have a diagram of those muscles along the lateral aspect of the trunk. And there's a list of the muscles there. Next, we have the spiral line, which is kind of exactly what it sounds like. It's a series of muscles that spirals around the body. The way I picture it is kind of like a double helix, you know, like a DNA double helix that spirals around the body. And it's going to help with rotational movement of the body along the transverse plane. And again, there's a picture of the muscles involved. And we have a list of the muscles and the connective tissues involved. Bringing those muscles again, all the way from toes up to the trunk. Now we also have functional lines, and functional lines are a little bit different. And the two that I'll talk about is the back functional line and the front functional line. These are again a series of muscles, but they are less so used in posture and more so used in movement. So what they essentially do is connect one arm over to the contralateral hip, and it's going to help increase the lever motion, so it's going to help in movement. So two examples. One would be if we're throwing a ball. You're going to use that leg to help you when you're throwing a ball. You don't just stand and do this. If you're gauging your leg, you're going to use a series of muscles that's going to allow you to increase your power. The same thing with kicking a ball. Rather than just standing and kicking the ball, if you use your muscles to kick the ball as well, you know, your arm muscles and getting all of that in there, you're going to increase your power. So now we're going to look at some stretches, just some different ways to stretch these different myofascial lines that we've talked about. So first we'll stretch out the superficial back line. One stretch you can do is the downward facing dog, which looks like this. Another stretch you can do is the balasana, or the child's pose, typically more so used in yoga, which looks like this. And those are ways to stretch out those muscles used in the superficial back line. Now the superficial front line, two different stretches. One would be a bridge, which I'm not great at, but looks like this. And another would be leaning back into hip extension. So on the knees, leaning back. If we're to stretch out the lateral line, we can do a half moon stretch. So we're standing, legs together, arms in the air, stretching to each side. We can also do the triangle pose. Reach down, arm in the air, you're going to open up the chest, look up to the sky. And we can do this on both sides. It's always important with these lines to remember that they are bilateral, so they're going to work on both sides of the body. It's almost like a mirror image of each other. That's important for the personal trainer. One, because we need to recognize if there's any deficiencies on one side or the other, we have to be able to recognize that and know how to fix that, because then we'll have some problems in posture and in movement. And we have to be able to stretch both out. So I hope this was a good summary. I will just show my works cited there as my reference. And thank you.